Hey everyone, welcome back to the Mind Maze. In today's episode, we interviewed internal doctor Tawhida Khatoon, and she was able to give us more insight on how, with her patients, she deals with mental health and give us her perspective on what mental health may mean to her and how she views it within her own day-to-day life.
All right.
These are my group mates.
I'm Arshia.
Hello.
I'm Liana.
Hi, Liana.
Hi.
And Arshia.
Yeah. Hi, nice to meet you.
Okay. What grade are you guys? 11? Junior?
Yes.
Yeah, we're all 11.
So, what's the context of this interview? Can you tell me a little bit?
So we are doing this event called HOSA, and our main event is called Mental Health Promotion. Our main focus on it is schizophrenia, but we're able to interview doctors or people who work in the medical industry like you and just ask them general health questions.
Okay. And how are you going to use this?
We're just gonna go ahead, Leona.
So basically, we just want to use this interview as a way to prove that we talked to a mental health consultant before we created our account and we have a knowledge of what we're talking about.
Okay.
And we're going to, if it's fine with you, is it okay if we upload the audio of this interview into Spotify? Because we also have a podcast where we've interviewed other mental health professionals and we've put their audios in there, like an interview.
Oh, okay. Yeah, you can probably use the audit. If you can make me sound good. But what is your podcast called?
I'll send you the link.
Yeah. We're called the Mind Maze, so that's kind of our whole campaign on Instagram and YouTube and all of our social media platforms. And on top of that, we kind of use the interviews as a way to let other people know and get help other people get a perspective of mental health from the healthcare point of view, because I know that a lot of people have a very general baseline idea of what mental health is, but I don't think they have an idea of what it is from a healthcare standpoint. So I think our podcast is able to help broaden people's perspectives on mental health overall.
If you'd like to see more insight about it, we do have an Instagram as well, and a link tree where we post everything that we do and things that we're planning to do in the future.
Okay. All right. Is it okay if I take it off camera, or do I have to be on camera?
Yeah, that's
Whatever
fine.
you want, it's fine.
Okay. Yeah, I think my video is not set up properly, so I will. Okay. Because you're gonna record just the audio, correct?
Yes.
Yes.
Okay. And you said your focus is on schizophrenia.
Yeah. Schizophrenia, but we know you don't have a complete focus on that, so
Yes.
we'll focus more on just general mental health.
Okay, that sounds good.
Nothing focused
I'm
on
not a
that.
psychiatrist. And
Yeah.
I do have to read a disclosure statement before we go into the interview.
Okay. All right, that's completely fine.
Yeah. Okay. You can start.
Okay, we'll just start really with a simple question. How would you? Can you just describe exactly what your career is and what do you do in it?
Okay. So my name is Tawhida Khatoon. I'm a general internist with the focus on hospital medicine. So I've been doing this for about 24 years now. Because I started my residency in 2001. I graduated from University of New South Wales in Australia in 1999, and then I moved, to a different country. There was a bit of preparation time and getting into residency. So I mainly practice adult medicine. So 18 and above is my focus, and my career is mostly based on people really sick who are admitted to the hospital. So that's my focus of work.
Thank you very much.
Okay, so our next question is that we know how specifically in our culture too, mental health is kind of a taboo. So why do you think so many people are afraid to talk about their mental health?
Right. That's a great question. So before I go into, answering all your questions, I just want to let you know, I want to make it clear, when I'm a practicing internal medicine physician, this discussion is for educational and information purposes only. It's not a substitute for professional medical or psychiatric advice, diagnosis, or treatment. If anyone you know is struggling with a mental health concern, please reach out to a qualified healthcare provider or call your local emergency numbers. The views I share here today are my own and do not represent that of my employer or any affiliated institutions. Okay, so that's a great question. There's a Latin saying called mens sana in corpore sano, a sound mind in a sound body. So mental health is part and parcel of your overall health, and it's very deeply interconnected with your physical health. It's mental health, you could define it as somebody with a balanced cognition, emotional resilience, and behavioral skill that helps them function as a very well-balanced individual in society. But it's true, when we talk about mental health disorders, there is a big taboo with talking about mental health disorders. And sometimes it's cultural. In some cultures, it's a bigger taboo. And then in other cultures, I think it emanates from basically a fear of being labeled as crazy. It's like a weakness. It's some people think it's a weakness in people if there is shame associated with this. So it becomes something that people don't want to talk about or admit to because they will be perceived as weak.
Thank you very much.
Our next question is kind of going off of the last question, but I know since there is a taboo surrounding things such as mental health, how do you think we could encourage people in society to moreover be willing to participate in conversations like mental health, and how do you think we could potentially get rid of this sort of taboo or the kind of feel around mental health within specific cultures?
I think like what you're doing, talking about it more, encouraging people to open up, trying to destigmatize it, thinking of mental health illness just as like we think about any other illness, just like we talk about asthma or diabetes. We should open up the discussion about mental health issues, and attaching less judgment to people who suffer from mental illness. Also, reaching out and making connection with those people. That's how we can probably try to destigmatize it.
Our next question would be, how can families or friends support someone struggling with that without making them feel judged?
So before a person will open up to you, I think you have to kind of build trust. That's what is important. Building trust and, trying to kind of encourage them to open up more. And you can try starting the conversation with things that are not necessarily deep diving into mental health right away. You can start talking about their, how they're sleeping, how they're eating. Are they participating in activities, or are they feeling isolated? So you can start off there, and then people might feel more open to talking about those things, and and then you pick up little things. And obviously, if you ever come across anybody who is feeling very isolated or depressed, or have, opened up to you or said anything that is a red flag, you should register that and seek help. You don't have to deal with it yourself because you're not professional individuals, but talk to someone like your school counselor, your teacher, your parents, but alert someone if you hear something that raises concerns or a red flag.
Okay, so our next question is, how can we encourage more open conversations about disorders like schizophrenia?
Schizophrenia is a very specific mental health disorder. It has, it is associated with neurochemical imbalances, and it can be very disruptive for a patient and their family. And it can be a huge stress on, on the patient themselves and the people who are kind of living with that person or dealing with that person. So what did you want to know about schizophrenia?
It's just how, like, you think that we can encourage more conversation about it.
It's in the same way that you can encourage conversation about any mental health issues. Schizophrenia is when people can have symptoms like hallucinations, delusions. They feel like people are out to get them. They have sometimes negative symptoms and sometimes positive symptoms. So positive symptoms are those of delusions and hallucinations, or sometimes they will be withdrawn. They might just go in and shut their door, not come out for days, not interact with others. They may be hearing voices, and oftentimes that can be associated with other substance abuse disorders. So again, if somebody has those issues, they need to seek professional help. So schizophrenia is a specific disorder where professional help is very important. And again, destigmatizing, just thinking of it as like any other physical health issues. These patients need not just medications, they need psychological therapy, cognitive behavioral therapy, etc. So, yeah.
Yeah, okay. So our next question is kind of more schizophrenia specific, like related. Sometimes in like mental health disorders like schizophrenia, people aren't able to be aware of their symptoms because they don't believe that, like, they believe that their own reality is true. Like, for example, people with schizophrenia believe that their hallucinations are true, so they may have a hard time differentiating or actually accepting the fact that they do have a disorder. So within your own experience, what's kind of like the hardest part about trying to deal with patients who may not accept that they need help or treatment?
True, it can be sometimes very difficult to convince these patients to seek treatment. So first of all, if they're having some delusional ideas or hallucinations, it's important for you not to challenge it. Don't challenge their delusions. You have to ask them, encourage them, and to seek like professional psychiatric help.
For our next question, how would you define mental health in your own daily practice and what you do every single day?
So again, we talked about so DSM doesn't have a definition for mental health. They have a lot of definitions for different types of mental health disorders. But the absence of illness is not health, right? So again, like I said in the beginning, a healthy mind is a balanced cognition, emotional resilience, and well-developed social skills. And it's kind of similar to emotional intelligence. So a person who's emotionally intelligent is somebody who is aware of themselves. They can regulate themselves, they have empathy, motivation, and they have ability to connect with other people in society. So a person who has those skills, and everybody has different levels of those skills. People who have really highly developed those skills, they're very highly emotionally intelligent, and they do excellent in society. but everybody has some degree of these skills, and you can learn those skills. So again, your mental health is associated with physical health too. So somebody who wants to have a strong and resilient mental health should have good sleep, at least 8 hours of sleep, balanced nutrition, good hydration, and good social skill connection in society.
Okay, so our next question would be, can you describe some effective ways patients can manage their stress, anxiety, or depression in their everyday life?
Good question. So stress, anxiety are present in everyone's life, right? And those stresses can be sometimes overwhelming stress. So we should all learn to kind of deal with stress. And sometimes when this stress is overwhelming, people can become demoralized. And demoralization is not always depression. It could be reactive to the situation, and those people basically go into this withdrawal and conservation state where they're like conserving their resources. They become a little bit inactive. That doesn't mean they're always depressed, because they might feel encouraged once that stressor is removed. They bounce back. Depression is a little bit more persistent symptoms. So when anything becomes a disorder, when it's persistent, and it may affect your ability to function in society. Okay, so when people are depressed, some of the coping skills are, you can like connection with people, seeking help, encourage and enhance engagement. Maybe learning how to cognitively restructure or how to look at that stress, learning different skills. And sometimes you may not be able to kind of come up with those by yourself. So you need help. So we encourage people to either talk to someone they trust or get professional help from a psychologist or a psychiatrist in the form of cognitive behavioral therapy. Some coping skills could be just, faith-based support. So people who are kind of religious and have a faith community, they can go and pray. Prayer helps, meditation helps. So those are also part of this coping skills. Promotion of social contact, increasing, have a trusted individual or a group of people that you can trust, you can open up to, can help you solve your problems. Okay, so also being hopeful, exploration of hope. When people lose hope, that's a red flag sign. So yeah, so these are the symptom management. And then in addition to this, some people may need medication as well. But yeah, so social contact, faith-based, cognitive restructuring, and learning coping skills.
Okay. So our next question is, especially being in the healthcare industry, how do you balance a medical treatment with empathy and human connection within your practice? And has there been challenges that you had to face when you have to choose one over the other?
Balance empathy with. Can you clarify the question?
Oh yeah, sorry. How do you balance medical treatment with empathy and human connection within your work?
Oh, absolutely. You have to do both. So you have to do both, and sometimes if the patient's resisting treatment, you have to take your time and build trust with the patient. You may have to keep coming back to that person and reassure. And there are situations when psychiatrists will have to commit that person if they're in danger of harming themselves or harming others. Those are extreme situations. But, part of your everyday dealing with your patient or even in society, empathy is extremely important, trying to put yourself in their shoes and trying to look at things from their perspective.
We'll just ask you one last question to wrap up this interview. How has your own understanding of mental health evolved since you started practicing?
That's a great question. So, I thought I was an internist, but every day when I see a patient in the hospital, 80% of my patients have some kind of, psychological stress, mental health issues. So, they're very interconnected. And there was a study in the Journal of Psychiatry that came out a few years ago, and that showed people with mental health issues, their longevity goes down by 10 to 25 years. So just, having the burden of mental health issue is profoundly impactful on your physical health and vice versa. And also these patients are often predisposed to smoking, drinking, substance abuse. So that's another issue that we deal with all the time. I think we need to make this an integral part of treating a patient holistically. And a lot of this, before it gets to the crisis point, I think we should focus on preventative strategies. And that is educating young people like you about mental health issues, how to recognize crisis situation, where to get help, things like that. One of the other things I often see in my adult population is also isolation and loneliness. It's, in fact, the American Surgeon General, Vivek Murthy, he declared loneliness as an epidemic in this country, and especially in the Western countries. Our elderly people, and even people who are constantly on, social media, still feeling lonely because that human connection is missing. Also, lack of support system. If you see someone who's looking isolated or lonely, always reach out to them. Even a smile, a hello can brighten up their day. And then this is a thing that has to be kind of tackled in a bigger context, like increasing community resources to support our elderly, increasing resources for young people to make connections and creating spaces. So that will help with their mental health resilience.
Does anybody want to ask any last questions?
I think we covered everything.
Well, it was really exciting talking to you people, and congratulations. I'm glad.
We appreciate your time, and we thank you so much for your thoughtful answers.
Yeah, we greatly appreciate your insight on this topic.
All the best to you.
Thank you. Have a great day.